So one thing that I want to chat about is the love hormone. So oxytocin is a hormone in our body. It's a powerful hormone and a neurotransmitter. And oxytocin is actually known as the love hormone or the cuddle chemical. Yes, cuddle chemical, because it plays this role, a really important role in the emotional bond between a mother and her child, but it also plays a big role in our social bonding, trusting other humans, and even sexual arousal and intimacy. And so oxytocin is released during breastfeeding, it's released during childbirth, and it's actually released during any physical contact that we have with other humans, whether it be sexual or not. So hugging your friend, hugging your child, hugging a loved one, having sexual intimacy, holding hands, this all releases oxytocin. And oxytocin isn't just about interpersonal connection. It actually has a lot of other functions. So the hormone oxytocin, it actually affects the uterus during labor and delivery. It helps stimulate the flow of milk for lactation. It also helps to regulate our heart rate, our blood pressure, and it has some role in digestion as well. And probably one of the biggest things it does, it has a calming effect on the body. It makes you feel relaxed and it makes you feel loved. And so there's quite a bit of scientific research around oxytocin beyond just the beneficial effects it has between the bonding of mother and child. It used to be thought that oxytocin was only necessary for a mom and her child to bond. This is why oftentimes they recommend skin to skin contact, putting the baby right on your chest, really helps you bond. That releases that oxytocin. But new research has come out showing that oxytocin can be really important in relieving anxiety, relieving stress, relieving depression, and even relieving pain in adults of both sexes. And so low levels of oxytocin in the brain can be associated with anxiety, but also things like autism, schizophrenia, PTSD, personality disorders, and even anorexia. So really big. And so why am I talking about this today? One, it was Valentine's week, so we're talking about love. Love is in the air. But when it comes to menopause and perimenopause, there's a huge connection. A lot of women come to me and they say they just don't feel connected. They feel like they've lost that love and feeling, so to speak. And there is a connection between perimenopause, postmenopause, and the decline in estrogen. So the decline in estrogen can reduce your oxytocin levels because estrogen actually plays a really big role in the release and the synthesis of oxytocin. So estrogen has been studied and they show that estrogen can increase the synthesis or the creation of oxytocin and the secretion of oxytocin. Plus, it also increases the expression of the receptors for oxytocin in your brain. So you make more of it, you deliver more of it to the parts of your body, and also the receptors in your brain that actually register the oxytocin, those are upregulated when you have proper amounts of estrogen. And so there's even studies that show just a single dose of estradiol, estrogen replacement, one dose can significantly increase circulating levels of oxytocin and reduce anxiety and make you feel more calm, more connected. And so what ends up happening in peri and postmenopause is we start to feel blah. A lot of women can't even explain it when they tell me they just don't feel that urge to be intimate. They don't really want anyone to touch them. They just feel and they're not really interested in social gatherings. They might just say be invited to something, I'd just rather sit on the couch. And that is really because estrogen really helps the body to produce and release the oxytocin from the pituitary gland in the brain. And that is responsible for social behavior, our desire for social behavior or social connection. It's important for our emotions. And of course, it's also related to libido and reproduction. But when estrogen levels drop, then the production, the release of oxytocin, that's reduced as well. And that results in just being antisocial, being emotionally detached, and reducing our libido. So low levels of estrogen equal low levels of oxytocin. And that can be one of the reasons why we're just feeling this way. And so this is why I always recommend testing estrogen levels, optimizing estrogen when necessary with bioidentical hormone replacement, and getting yourself topped off, even if you are in perimenopause and it's just starting to be lower than it should be, it's really important. But let's say your estrogen levels are already good. There's other things that also increase oxytocin, or if you're just not looking for hormone replacement right now, optimizing your vitamin D. So getting your vitamin D between 60 and 90 on your vitamin D test. Now, your regular GP, when you get your test done, the level that is considered normal, it can be as low as 20, and that's just not okay. But vitamin D levels between 60 and 90, that is optimal for producing oxytocin. There is a huge connection between the ability to produce oxytocin and vitamin D levels being optimized. Another one's vitamin C. So vitamin C, we can get that just from eating fruits and vegetables, but studies show that vitamin C stimulates the secretion of oxytocin. So just getting 500 milligrams of vitamin C per day is enough to help to improve your oxytocin levels. Also, probiotics, making sure that your gut microbiome has the proper microbes in it. And one of them is lactobacillus. So making sure that you have adequate levels of balanced probiotics and prebiotics to help balance your gut, and that can really be helpful for producing the oxytocin and making sure you have enough of the good bugs in your microbiome. And then, of course, things that you can do in addition are going to be hugging people. So having some type of human touch, whether that be hugging a child, hugging a best friend, holding hands, having some type of touch connection, super important. But let's say you don't have anybody, pets count too. So cuddling with a pet, that counts, and that actually has been scientifically proven to raise your oxytocin levels. Of course, sexual intimacy, that is another big one for raising oxytocin. Singing and listening to music is also another good one. And then there's also some studies that show a loving meditation, a self-love meditation, can actually increase oxytocin levels as well. That's my little spiel on the love hormone. And now I'm going to go ahead and answer your questions. The oxytocin, so important. There is also prescription oxytocin delivered as a nasal spray that you can get. But in my opinion, it's really unnecessary because you can produce your own oxytocin. And I'm a naturopathic physician. And in naturopathic medicine, we are all about upregulating your body's own innate ability to make the things it can make. Now, you might ask, well, why do you recommend hormone replacement therapy? Because if you're all about upregulating the body's natural ability, then why aren't you doing that for estrogen and progesterone for women? And the truth is that once we hit perimenopause and menopause, our body does not have the ability to make adequate levels of those hormones anymore. So we have to replace them. But by replacing those, then we can make our own oxytocin. So we don't need to replace everything. We just need to replace the bare minimum, the root cause things. And the root cause for women in perimenopause and menopause is our ovaries have stopped working. And there's just not much we can do about it other than replacing our hormones. Of course, when I say there's not much we can do, I mean there's not much we can do to raise those estrogen and progesterone levels up, but there's also many things we can do to help with the symptoms. Strength training, eating a proper diet, drinking our water, anti-inflammatory foods, stress reduction, toxin removal. All these things are so very important, but none of them are going to raise your estrogen and progesterone levels. But in the case of oxytocin, we can raise that on our own without bringing in oxytocin. So hopefully that's helpful. Oh, I see all your chats. Very cool. Yes, animals are amazing for raising oxytocin. So if you don't have a person that you can hug on regularly, definitely get an animal, a pet, a cat, a dog, whatever, a bunny. It doesn't matter. Animals are wonderful. Awesome. Okay, so let me answer some of the questions. So why isn't my body converting T4? So T4, for those of you who don't know, that is the most abundant thyroid hormone that your thyroid makes. So it has 4 iodine molecules in it. That's why it's called T4. And what has to happen for your body to actually utilize that thyroid hormone, there has to be a conversion that takes place. And there's some nutrients involved, some B vitamins, some magnesium, some selenium, some zinc. And that transfer has to happen where it takes one of the iodine molecules off and then it becomes more active, the active version of thyroid hormone. That's what gets into your cells and does all the action. Now, T4 does have some activity as well, but some people their thyroid is working, so their thyroid is making enough of the raw T4 hormone, but it's not making that conversion. And that can be a liver issue, that can be a gut issue, or it can be a nutrient deficiency issue. Definitely that can be worked on. You can definitely get some testing done to see what's going on if you're deficient in anything. And those are things that we do in our GLOW protocol program, which is a natural medicine implementation program that takes you through uncovering the root cause of what's going on. And most of the times it is nutrient deficiency that I see why people are not doing that conversion very well. It can also be toxicity. Let's see, my cortisol is really low. How do I raise my cortisol? No energy. So low cortisol is a lot of times due to stress or to not being able to sleep properly, not getting the proper nutrition, or having some type of chronic pain. And so many things that you can do to help your cortisol are going to be to really optimize sleep, optimize rest and recovery, do some type of mindfulness, meditation, or gratitude process that really helps to shift your body from the sympathetic nervous system state to the parasympathetic nervous system state that rest and digest and can help to modulate cortisol. One of my favorite ways to help cortisol is using adaptogenic herbs while you're doing these lifestyle practices. So while you're working on your stress reduction, while you're working on your nutrition, while you're working on your sleep, adaptogenic herbs, things like ashwagandha, rhodiola, ginseng, tulsi, those are great ways to help to modulate your cortisol and make better use of the cortisol that you do have, so that your body is not undergoing as much stress and it's able to deal with that stress a little bit better. So one of the things we're going to give away, Daily Glow, is my own formulation. It's a food grade, very high quality, multivitamin, multi-mineral with adrenal, thyroid, and hormone detoxification support. And so it does have in it has your rhodiola, it has your ashwagandha, it has ginseng. So it has things to help optimize your cortisol. Now, I'm not saying that this is the go-to end all, that you don't have to do anything else, but while you're working on other stress reduction practices, adaptogenic herbs can be super helpful. Please advise if Glow Below can be used if you have lichen sclerosis. I was advised by dermatologist to use it because of vitamin E. Yes, we have had many people use Glow Below who have lichen sclerosis, which is it's a condition that there's a lot of irritation in the tissue, sometimes burning, sometimes degrading of the tissues. And so it can be very helpful, but a lot of times the more severe the condition, you might have a little bit of warming or burning when you first use the Glow Below, because it's like actually working. It's like if you scrape your finger and you put the antibacterial ointment on, it burns at first, but then it soothes it. So that can happen. So I would say if your condition is severe, you can start with a half dose and then work your way up to a full dose. And it definitely can help. Now, is it the be all end all? You may need extra treatment. You may need laser. You might need some other treatment to help you overcome that condition. But we have had people see great improvement from both the estrogen that's in Glow Below, but also the other ingredients that are very soothing to the tissues. They're soothing, they're healing, they repair the skin barrier function. And so very helpful. Yes. So you definitely can use it. Does your program help with vaginal atrophy? If you haven't been able to have sex for 8 years, is it too late? Absolutely. So vaginal atrophy is one of the main conditions that happen to women when they lose estrogen. Estrogen is so important for the health of our vaginal and vulvar tissues. And so when we lose estrogen, the tissues actually physically start to shrink and shrivel up. The skin integrity, we lose the elasticity, we lose the moisture, we lose the nerve endings shrivel up. And so physically things start to shrink and shrivel, and the skin barrier starts to erode. We're more susceptible to urinary tract infections, or more susceptible to yeast infections. and we have a lot of pain and discomfort, sometimes burning, sometimes dryness. And so definitely local topical estrogen, like in our Glow Below product, that's going to be super important because it's going to have ingredients. So this is our Glow Below. This is available outside of our Healthy Hormone Club program. That is our hormone replacement program. This is not considered hormone replacement because it's a low dose topical estrogen. And even though it is estrogen, it stays local to the vaginal tissues. And in addition, it has ingredients such as shea butter, sunflower oil. It has cocoa, beeswax, hyaluronic acid, and vitamin E, and almond oil. And these things all together are really a powerhouse. So you can go to glownaturalwellness.com and you can go in the shop and you can see Glow Below there. If you click on it, you can read all about it. But super, super helpful. So this alone can be very helpful, but also systemic hormone replacement will also help with reversing that atrophy as well. It's just a longer term. The Glow Below, the topical low dose estrogen, that's going to be like a quicker recovery. And then the systemic will help to keep things at bay and also help with other symptoms like hot flashes, weight gain, increased risk of heart disease, bone loss, brain fog, all, the skin on your face, losing collagen, all of those other things, the rest of your body. The Glow Below, which is the topical low dose vaginal estrogen, that stays local to the vaginal tissue. So the vagina, the vulva, the urinary tract, that is what benefits from the Glow Below. And then all of your other symptoms, should you have them, that's what's going to benefit from the systemic hormone therapy, the bioidentical topical hormones that go throughout your body. So hopefully that's helpful, but no, it's definitely not too late. The funny thing is our body is so incredibly regenerative that there's never too late. Now, will it take more time to get from you haven't had estrogen for 8 years to where you felt in your 30s? Yeah, it might take you a little longer to get there, but you absolutely can. Our cells turn over. We have new cells in our vulva, new cells in our vagina every 30, 60, 90 days. And it's definitely not too late. It's never too late. Awesome. Let's see. Will a replay from yesterday's webinar be made available? I think you're talking about our Glow Protocol program coaching call. So yesterday we had a program coaching call for all the members of the Glow Protocol. So those are in your member portal, and this is just available to everybody. There will be a replay of this, and yes, there is a replay of that as well. So your Glow Protocol member portal will have the replay of our coaching call. They usually are posted the Monday after the call, and then we will put this up probably within the next 24 to 48 hours and get that replay out to you as well. Hey, Michelle, I'm a health and fitness coach, and I have a lot of clients who are struggling with extra weight from hormone struggles. I get it. That's one of the hardest parts, seeing women work really hard and still having trouble because they are hormone deficient. What would your main recommendations and nutrition guidelines be for them? Fitness and nutrition wise for women in menopause, we do have to do things just a little bit differently because we are a little more sensitive to sugars. It's a little harder for us to build muscle because when we lose estrogen, we don't have that contraction as well. There's myosin and actin in our muscles, and our estrogen is necessary to have our muscles contract. And when we can't do that, it's harder to build muscle. Come on in. I think the prize patrol is here. Oh my God, look at this. Oh, with his heart glasses. Perfect. We talked about the love hormone today. Nice job. All right. So we are giving away, this is Viewer's Choice Day. So we're going to do 2. So whoever packs and picks is going to get your choice of Glow Below. Oh, no, sorry. Glow Below, Daily Glow, or Glow PM. So Glow PM is our nighttime formula. Oh, you want me to wear the glasses?
No.
Oh, just for everybody. Okay, Glow Below is Glow PM is a nighttime formula that has melatonin, it has calming herbs, magnesium, and so it helps you sleep. It also helps reduce cravings, and it helps with metabolism, and anxiety too.
The camera's wearing the glasses.
Oh,
right
they
now.
can't see that.
I know.
Daily Glow is a daytime formula that has the adaptogenic herbs that we talked about earlier, but it also has hormone detox support, and it has thyroid support and adrenal support. So that's the daily multi. And then Glow Below is what we've been talking about lately. This is the topical estrogen vaginal moisturizer. You get to pick. So what are they going to do to win?
They have to say they have to say kittens and dogs.
Oh, they have to write chickens and dogs.
No, kittens
Okay.
and dogs.
Okay, so you have to write, and people are writing chickens and dogs. Kittens and dogs. So kittens and dogs in the chat. And we were just talking about how kittens and dogs help increase your oxytocin levels. Did you know that? When you hug Combo's our cat, when you hug Combo, it increases your oxytocin, the love hormone. And when you hug mommy, it helps you too. All right, so we see you guys are all putting that in there. There's a slight delay, so we'll give you 1 or 2 minutes. And then what you get to do, if Paxton picks your name, you're going to pick one of the 3 items, either Glow Below, Glow PM, or Daily Glow, and you'll tell us which one you want and we'll send it to you. All right, so you got somebody?
Yeah.
Okay, who is it?
The person who I highlighted.
Oh, this one here? Okay. Coral Dirksen, you were creative and you used 2 emojis. And I think Paxton like that. You like the emojis?
Yeah.
All right, Coral. So what you're going to do is you're going to email support@glownaturalwellness.com and you're going to tell us what you want us to send you. Either Glow Below, Glow Below. People thought I was saying Glow Below. Glow Below, Daily Glow, or Glow PM. Those are your 3 choices. Okay, and then Paxton, you got another one? We'll do 2.
There's 21 new messages.
Or you can scroll.
Where?
Can you scroll it? Here.
Yeah, no, you're putting it on there.
Oh, it's you got to bring it over here. Here, bring
Yeah,
it
I
up
know.
here.
I'm trying.
All right, is that the winner? Tina, who says, I have 3 cats and 2 dogs. We're the second winner. So you can go ahead and tell us whether you want Glow Below, Daily Glow, or Glow PM. And if you're watching on the replay, Paxton will be picking 2 more people this weekend. So be sure you write kittens and dogs in the comments below the video. All right, thank you, Paxton. You want to say bye?
Bye. Here's your glasses.
Awesome. Thank you so much, Paxton.
Bye.
Awesome. Can you close my door and lay out for me?
Like always.
Thank you. I know you always do. I just remind you. Oh, kids are so funny. All right, let me go back to the questions. So I was talking about the fitness. And so a couple of things I recommend for women who are menopause. Number 1, if they can, test their hormones and replace their hormones if possible, because that's going to make their life so much easier. They're going to get more benefit out of everything they put into their nutrition, their exercise. But regardless of whether they're replacing hormones or not, focusing on strength. So strength training, when I say focusing on strength, I mean doing at least 2 workouts, 2 full body workouts per week, or 1 full body, 1 lower body, 1 upper body workout, where you're going to failure on each exercise or close to failure. And what I mean by that is you're lifting a weight that's heavy enough for you that you're getting to the point where you just can't, if you're doing bicep curls, you're doing them and then you can't get another one up. So that's where you go to, when I say failure, or to muscle exhaustion. Now, for some people, this might be body weight. For some people, it might be like really light resistance bands. And for some people, it might be some heavier weights. And so doing that 2 to 3 times a week, strength training, a little bit of cardio, but walking after meals. I wouldn't focus on the cardio, because when you lift weights, you are telling your body that the body needs to change in a way to make you stronger. Because it's like you're putting the stress on your body, lifting these heavy things, and your body's okay, Alicia's going to be lifting these heavy things on a regular basis. So I better put my body in a state that makes it stronger so I can more easily lift those heavy things. So a state to build muscle is a state where hormones are being more optimized. And so it's going to make you leaner, it's going to make your muscles stronger, and it's going to make your metabolism such that it feeds your muscles. Now, if you're doing cardio all the time and you're running for hours, or you're doing the Stairmaster, or you're doing these like cardio fitness classes, and that's really all you're focused on, your body's going to say, okay, she's doing a lot of cardio, she's doing a lot of running, she must be running from a tiger or a bear or whatever. And so let me make it more efficient. And so it's going to actually make your muscles smaller and try to make you lighter, basically. And muscles are they burn more calories when you move them. So your body doesn't want to do that and wants to make you more efficient because you're going to be doing all this cardio. So it's going to not make you build muscle. And then you're going to be more like skinny fat. And you're going to make you better at the long distance running or the hours of cardio. And so you're going to end up burning less calories when you do that, because it's going to make you more efficient. Whereas when you do the weight training, you actually burn more calories after the workout than you do during the workout, because muscle is more metabolically active. So the more muscle you have, the more calories you burn throughout the day. So always prioritize strength training. And then for cardio, just focus on steps. So like getting 10,000 steps a day. If you already get 5,000, maybe aim for 10,000. If you're on 2,000 a day, maybe aim for 5,000. So it depends on the person. And then for nutrition, I like to focus on protein, and I will do a video on this. I have it on my list of videos to make, but focus on 1 gram of protein per pound of ideal body weight. So if your ideal body weight is 120 pounds, then you're going to aim for 120 grams of protein. Another way to do this is to take your height, and at 5 feet, that would be 100 grams of protein. And for every inch over 5 feet you would add 5 more grams of protein. So I am 5'5", and so I would be aiming for 125 grams of protein. But my ideal body weight is at 135 because I have a lot of muscle. So I actually eat closer to 135 grams of protein per day. And then as far as the other like fats and carbs, you do want to have a certain amount of healthy fats. Ideally, you don't want to go under 50 grams of fat per day, but you can go over that for sure. And then carbohydrates just as needed, just fill in. I am not a low carb person or a keto person, but depending on whether you like a lot of plants or like a lot of carbs or grains or how you digest them, it's going to be different for everybody, but those are my general guidelines for women who are perimenopause and menopause. I do like to make sure they're drinking plenty of water. I do like to try to keep fiber at 30 to 40 grams per day, and I like to keep added sugars under 25 grams. So hopefully that's helpful. I'm not sure. Let's see, my teen daughter and I have gained a lot of weight, especially around our abdomen due to stress and hypothyroid. Nothing working to lose weight. I have gained 60 pounds and my teen has gained 80 pounds. I'm super upset and miserable. We already avoid gluten and started intermittent fasting. What else will help with this insane weight gain? I would definitely check, since you said you have hypothyroid, you didn't mention whether you are being treated for your hypothyroidism, meaning are you on a thyroid glandular? Are you doing any thyroid support to help to have your thyroid function properly? Because that will definitely cause you to gain weight if you don't have any support there. So that would be my number 1 thing. And then number 2, I would focus on protein again and focus on weight training as well. But that is an extreme amount of weight gain. I'm not sure the time period. It doesn't say how long it took to gain 60 and 80 pounds, but that is pretty extreme. So I'd definitely be making sure you're getting a full thyroid test with free and total T4, free and total T3, reverse T3, and thyroid antibodies, and make sure that you're getting treated so that at least your free T3, that's one of the ones that I look at most. Make sure that's above 2.8 or 2.9, your free T3, because that's going to mean that you're actually getting that function. Sometimes, like that first person that asked who was not converting the T4 to T3, sometimes in conventional medicine, if you have hypothyroidism, they'll just give you levothyroxine, which is Synthroid, that's the brand name, but that's basically just T4. And unfortunately, if you don't make that conversion, then that T4 is not going to help you. You might need a combination of T4 and T3. You might need a thyroid glandular, or you might need help making that conversion. So really important to look into all of those things. Let's see, I hear that if one has uterine fibroids, hormones can make them grow. How do we prevent uterine fibroids from growing if we want to start an estradiol and progesterone so that we don't stimulate growth? So uterine fibroids tend to grow for a couple of reasons. One is toxicity, and the other is excess or hormone imbalance. So if you're replacing your hormones, you're going to be replacing them in a balanced way, and that can really help to keep hormone or uterine fibroids at bay. So I do have a blog on my website about how to shrink fibroids naturally. So there are things you can do nutritionally, lifestyle. Castor oil packs are wonderful, but there's some great things you can do lifestyle wise. And then also replacing your hormones at the proper levels to balance them out can be super helpful. So hopefully that's helpful. Okay, someone else also asked about fibroids. Again, I do have a wonderful blog on my website. So glownaturalwellness.com. If you go to the blog, you type in fibroids. There's a great blog that gives you lifestyle practices to shrink fibroids. But one of my favorite go-to practices is castor oil packs. So you can do them across your breasts. You can do them on your abdomen. You can also do massage. Those are great. And then also some enzymes, some enzymes can also help with the breaking that down as well. See, I'm going through perimenopause and have been experiencing pain in the groin area that intensifies during menstruation. Is there any relief treatment, preventative remedy, preferably all natural? It could be due to prostaglandins, or it could be due to some other things going on. I would say castor oil packs might be a good thing for you to try on a regular basis. Like when I say castor oil packs, for people who don't know, it just involves using organic castor oil, saturating a organic cloth or cotton cloth and putting that over the area. And there's also one of my friends, Dr. Marisol. She's a former naturopathic physician. Now she runs her company called Queen of Thrones. She has a great little kit that it makes it super simple. It's a little thing that you tie around your waist or around your chest, and you just pour the castor oil on and you just sit there. And it helps, the castor oil gets into your pores and it gets in and it helps to break down like fibrous growth. So that can be super helpful. Let's see, does external use of estriol vaginally require progesterone to balance it? So if you're using estradiol or estriol, vaginally, it does not require progesterone to balance it because it's staying local to the vaginal area. So no, it does not require progesterone to balance it out. If you're using systemic estrogen, then you should get progesterone to balance it. What's the difference between the GLOW protocol and the Healthy Hormone Club? The GLOW protocol is a lifestyle-based natural medicine implementation program that teaches you how to understand the root cause of your chronic conditions. So we look at systems such as gut and immune health. We look at digestion and assimilation. We look at biotransformation and elimination. We look at heart health, cardiovascular health, circulation, blood sugar, all of those things. And we teach you the lifestyle practice of diet, nutrition, rest and recovery, sleep, exercise, movement, mindset, meditation, stress reduction, and supplementation, herbal, vitamins, minerals. We teach you all those protocols to help to optimize each system of your body. So that is the GLOW protocol. And it comes with health coaching. We do every other week, we do live coaching calls to talk about the protocols. We work a lot on foundations of health, the daily strategies that you're going to implement. We cover parasites and mold and toxin removal and heavy metals and all those things wrapped up in that GLOW protocol program. So it's root cause lifestyle medicine. The Healthy Hormone Club is designed for perimenopausal and postmenopausal women to replace the hormones they have lost. There is a 12-week lifestyle program in there to help optimize the hormone replacement or optimize lifestyle around hormone balance, but that is specifically to replace the hormones that have been lost during perimenopause and menopause. And the Healthy Hormone Club comes with the tests to evaluate your hormones, consultations with the hormone specialist, and the hormones that you need to replace to balance your hormones overall. We use topical bioidentical hormones, so very safe and effective, and everything's included in that program. We may also recommend some supplements or changing the diet or the topical GLOW below. And those are not included in the program. It's the systemic hormone replacement that is included in the Healthy Hormone Club. Okay, what are possible side effects of BHRT on perimenopausal, both little symptoms? In the past, I have not done well with hormonal birth control. I would get joint pain. I was considering bioidentical hormone replacement because my period has become irregular. I didn't get it for 3 months, considering bioidentical hormones, but I'm concerned about the side effects. Depending on the type, the dose, and the delivery method of your hormone replacement, there's different side effects. Hormones can come in different forms. They can come in oral pills that you swallow. Those do have side effects that include blood clotting. There can be some side effects with gastrointestinal issues. There can be some side effects with liver health. So we don't use oral hormones very much in our practice. Really, we don't use them at all in our Healthy Hormone Club. So that's one thing. Patches can sometimes have irritation due to the adhesives that are used. And topical hormones don't have any side effects if used at the proper dose. So of course, if you are using too much hormones, then you can get negative side effects from excessive hormones. Hormones are very Goldilocks. Too little causes symptoms, too much causes symptoms. In the middle is where you want to be. And in order to find that out, testing is really where it's at. Testing your levels, but also evaluating your symptoms. And that's why we include testing every 4 months and symptom analysis in our Healthy Hormone Club. So if you're being dosed properly and the delivery method is topical, there really are no side effects for someone who's getting the proper dose. The only minimal side effects that happen for maybe the first month in some women, you can have some increased breast tenderness because of the change in the hormones, and some women might retain water for the first 4 to 6 weeks, just because of also the change in hormones. Your body is trying to circulate those hormones around the body, and it can increase the amount of water in your body. And estrogen is also very hydrating. So your skin will plump, and if you have a lot of wrinkles and stuff, that will plump it up. Vaginal tissues will reverse atrophy. And so water is required for all of those functions. And so sometimes there's a little bit of water retention in the first 4 to 6 weeks, but that goes away. And those are only minor side effects, but long-term side effects, they're all positive. Side effects can be negative or positive, I guess, but improved brain health, improved bone health, reduced risk of cardiovascular disease, reduced risk of cancer, reduced risk of Alzheimer's. So there's so many benefits to hormone replacement. Speaking of heart health, Cedars-Sinai just did a wonderful study, and they showed how women on hormone replacement were 30% less likely to die of any cause than women who are not on hormone therapy. They were 20% more likely to have what they call coronary calcium score. And that coronary calcium score is basically how healthy your heart is. And so that is, they're going to have a better coronary calcium score. And also they're 35% less likely to have arteriosclerosis and a higher risk of heart attack. This is Cedars-Sinai. This is one of the most prestigious institutions when it comes to cardiovascular health. And so they did show that women who are on hormone replacement therapy have much better heart health overall. And they presented these findings at the American College of Cardiology conference last March. And so really great information from Cedars-Sinai. The verdict is that hormone replacement therapy is actually the risk of not being on hormone replacement therapy for women who have low estrogen levels is almost higher than the risk of being on hormone replacement therapy of any kind. And then topical hormones have virtually no risk because there's no clotting, there's no interactions with drugs, and so really safe and effective. I've been getting rashes. I think it's related to inflammation, something perimenopause related. I'm 46. Any tips to get rid of these rashes? That's a tough question for me to answer in this format because I don't know what's going on in your lifestyle. If it's strictly nothing has changed and strictly due to the drop in hormones, estrogen is anti-inflammatory. So it is possible that you have increased inflammation due to lack of estrogen. So if that's the only thing that's changed, it's possible that estrogen replacement could help. But I'd be willing to say that there might be something else going on, whether it be food related, microbiome related, some type of environmental exposure. So I can't with certainty say what it is, but those are just some things to think about. My family history has breast cancer and uterine cancer. Does that mean I should avoid hormone therapy? to treat my perimenopausal symptoms? Absolutely not. The studies show that women on hormone replacement therapy have more protection against breast cancer and uterine cancer than women who are not on hormone replacement therapy. So if you look at society as a whole, and you look at who gets breast and uterine cancer, is it women in their 20s who have the highest level of hormones? Is it women who are pregnant who have super high levels of hormones, higher than you'll ever have in your entire life? Or is it women who are in perimenopause and menopause who have declining level of hormones? The answer, in case you don't know, it's women who are in perimenopause and postmenopause who have declining or very low levels of hormones. And bioidentical hormones, so not synthetic hormones. There was a 2002 study, the Women's Health Initiative, and that was what gave hormones a bad name because they studied horse estrogen, Premarin, and like progestin, so a fake progesterone-like substance that was chemical that is nothing like progesterone in our bodies, but it was a synthetic version that was supposed to be similar. And they found that the women who had both of those together had a higher increased cancer rate. But the women who did not get the synthetic progesterone or progestin, they had lower rates of cancer, even though they were on a horse estrogen, which is times more potent than human estrogen, and it's not the same as human estrogen. So those women who actually take bioidentical hormones in the proper dose and delivery method for them have a reduced rate of cancer. So you actually have protection. And should you get a breast or uterine cancer and you've been on hormone replacement in the past or you're currently on it, you have a higher rate of survival. So if I had a history of breast cancer in my family, I'd be more likely to want to be on hormone replacement than if I didn't. So it is protective. Yeah, insert 1 gram of estradiol vaginal 1% cream 2 times a week. Can I use Globalo instead of the estradiol cream, or should I use them both? Personally, I'm not supposed to in this format tell you to stop a prescription, but you could use Globalo. It is equivalent to prescription estrogen in the dosage for vaginal topical estrogen. So you could use just Globalo. You should talk with your doctor about whether that's right for you. But that's my answer. How does BHRT affect your bowels? Can it cause constipation until your hormones are balanced? So hormone replacement therapy and progesterone do have some effect on gut motility. And so when women hit perimenopause and menopause, they can notice some increased constipation due to slower gut motility. Balancing your hormones can help. I haven't seen hormone replacement cause constipation. I've seen too high levels of hormones, especially oral progesterone, sometimes cause more frequent bowel movements, but I haven't seen it cause constipation. So usually it's probably going to be dietary, lack of fiber, lack of water, something like that. So it's not something that in literature or anything I've seen for hormone replacement to cause constipation. I've seen too low levels of hormones cause constipation. What is the optimal blood level for estradiol? You can look that up. It's going to depend on your age range and where you get your test done and how it's measured. Okay, I'm 51 and I haven't really had any problem internally. My vagina, like lubrication, pain, awesome. However, my clitoris has shrunken and significantly lost sensation. I can only have an orgasm with a vibrator, but it takes forever. I really don't feel pleasure or arousal. Can hormones put me back to where I used to be? Absolutely. Not everybody will have all the symptoms. So some women will not have vaginal dryness and some women will not have burning or pain, but some women will have a loss of sensation. And that sounds like what we're noticing is that loss of sensation as the nerve endings start to shrink. And so yes, topical local vaginal estrogen can really help, as can vaginal DHEA. And so those both can be helpful. It will take some time, but yes, for sure, you can get your sensation back. There's other treatments out there like the Mona Lisa, which is like a procedure you can go that has a laser. And that is one of the things. And then there's also PRP, which is platelet-rich plasma therapy, which they do on your vagina, vulva, and clitoris to make you feel more sensation. So there's a few different things that you can go. You can try the topical estrogen because that's like easy. You can just order it, you can do it at home, but you can look into some in-office procedures, which are really great for vaginal rejuvenation and restoring sensation. I do not offer those personally, but you can Google vaginal rejuvenation procedures and you can learn about those as well. How do you know when it's time to get your hormones tested? Okay, that's a great question. So I could do a whole video on this, which I probably will. So the best time to get your hormones tested is when you feel amazing. That's the best time. If you can, in your 25, 30, when you feel your best, that is the best time to get your hormones tested because that's going to be your baseline, right? So as soon as you start to notice, like you're feeling a little off, your periods are changing, you lost your sex drive, you're gaining some weight, you have some brain fog, any of those symptoms, and that's a sign that your hormones are starting to decline. And so that's a good time to test and see where they're at, what's going on. And then as more symptoms come up, you can test again if you haven't already started to replace your hormones. But if you can test when your hormones are, when you're feeling great, that's your baseline. Because here's the thing with any hormone test, there's going to be a range. So it's going to be, let's say, from 20 to 100, right? So anywhere between 20 to 100 is normal, but what's your normal? It might depend. Some women feel great on the lower end of the range. Some women feel great on the higher end of the range. So that's going to be a little trial and error when we start replacing your hormones. We'll put you to where we think you're going to feel good based on your symptoms and where you're currently at. But you might like to be up at the high end of the range, or you might like to be down towards the low end of the range, or might right smack dab in the middle. There's no perfect. It's going to be different for everybody. Just like some people like their hair curly and some people like their hair straight, or some people like more sauce on their pasta and less sauce on their pasta, right? It's just how it is. And so there's no perfect, but what I'm saying is the best time to test your hormones is when you feel great. But otherwise, if you just feel a little off, that's a good time to test your hormones. If your periods are starting to get irregular, that's a good time to test your hormones. Or if you just haven't ever had them tested, it's probably a good time to test your hormones. We offer a inexpensive test. Let me just see. I should know this off the top of my head. So I'm going to pull up if you go to glownaturalwellness.com and you go in the shop and you scroll down to order lab testing, click on hormones. It's the second little box. And you go to the hormone trio test. That is like a very inexpensive hormone test that's going to test your estrogen, progesterone, testosterone. And so right now you can get 50% off. There's a code called it's test50. It's right there on the page. If you go to our shop, glownaturalwellness.com, and you go to shop, go down to testing, click on hormones, hormone trio test. And so it's very inexpensive. And let me see what the price is. So you can get it for $150 basically. And that will come with our recommendations. And you can upgrade for additional $79 if you want a consultation with one of my hormone specialists. So it's a great deal. You can do it at home. You don't need a prescription, or you don't need to go into a doctor's office. And it's a great way just to know where you're at. How do I get your product? You can go to glownaturalwellness.com and click on the shop, and you can find everything we offer there. But if you want to join the Healthy Hormone Club, I'd suggest that you watch my hormone restoration webinar. It's at fixhormones.com. So fixhormones.com will take you through our hormone restoration kind of mini class. It's about an hour and a half long. And it really tells you everything you need to know to make that decision of whether you want to replace your hormones or not. And then just for watching that, you get 50% off our hormone program, which we actually have on sale right now for Valentine's week as well. So that by watching that webinar, you automatically get the lowest price we have available. So that's fixhormones.com is the masterclass. If you haven't seen it yet, if you've already seen it, and you want to make sure you get the discount for the Healthy Hormone Club, just email support@GlowNaturalWellness. Or if you got our email today or any of our emails this week, we are running a sale. So you just click that link and you can just get that sale. So Roberta, who asked about thyroid earlier, said her daughter is on Synthroid, but you're on natural desiccated thyroid. So I would ask your practitioner to retest your thyroid to make sure that your thyroid levels are good. And then I'd also look into possible mold toxicity or something else that's going on that is causing that weight gain if your thyroid is good. Yeah, that's too much weight to gain in such a short amount of time. There's got to be something not right there. So I would definitely look into that. Can use of bioidentical hormones prolong fertility in middle age? Not really. So you're not going to, at least the way we do hormone replacement. So the way we do hormone replacement is physiological levels of hormones. So we are not giving you hormones to change your sex. We're not giving you hormones in excessive levels to go against your physiology. You're just replacing hormones to optimal levels. And that's not going to change the amount of eggs that you have. It's not going to change how long you have till you go into menopause. But if you still have eggs left, balancing your hormones can improve your fertility, but it's not going to extend the timeline that you already had for fertility, if that makes sense. Also, changing lifestyle, eating healthy, getting exercise, getting proper sleep, toxin reduction, stress reduction, all of those things will also improve your fertility while you still have eggs. So hopefully that makes sense. You're so welcome. Awesome. Let's see. One other question I had is that Hashimoto's disease, I am on levothyroxine 0.75 milligrams. Is it possible to switch to support things instead of meds? So what you could do, and again, this is not medical advice, but you can do a thyroid glandular. So there are some that we have available through our online dispensary that are thyroid glandular. So they're desiccated thyroid and they work really well. And that combined with lifestyle can support thyroid health. And if you have Hashimoto's, so Hashimoto's is not really even though it is an autoimmune attack on your thyroid, it doesn't originate in the thyroid. It actually originates in the gut and the immune system. So Hashimoto's is an autoimmune condition, not a thyroid condition. So I actually have Hashimoto's and it's in remission. And when the triggers, so in order for Hashimoto's or really any autoimmune condition to cause problems, there has to be 3 things in place. So one, you have to have a genetic susceptibility to have an autoimmune condition. And if you have it, you have that one thing. So that you already have. You either have that or you don't. There's not a lot you can do to change whether you have the genetics to allow you to have an autoimmune condition. There's some people that have genetics where they'll never get an autoimmune condition no matter what they do. That's one thing. Number 2 is you need to have leaky gut. So you have to have some increased intestinal permeability, some issue with the exchange that happens between the gut barrier and your bloodstream. So something has to get through that shouldn't have gotten through. And then you have to have a trigger. And the trigger really can be anything from stress to gluten to a microbe in the environment. Triggers can be lots of different things. How you heal autoimmune condition is you remove the trigger. So for me, it was gluten. It could be toxic mold. It could be a lot of different things. It could be a traumatic event. So you remove the trigger and then you heal and seal the gut. And that was a big one for me. I had a lot of gut troubles growing up. I didn't know there was a connection between my gut and my thyroid. I didn't even know I had Hashimoto's or gluten sensitivity. And I grew up in an Italian family eating like 5 different types of gluten at every meal, but that's the story for another day. But yeah, so healing the leaky gut, removing the trigger, you can't do anything about your genetics, and then eating an anti-inflammatory diet. There's a lot of autoimmune protocols in our GLOW protocol. We have an autoimmune template that we lay over any of our meal plans. And after about 3 to 6 months, you can notice a decrease in your antibodies, a significant decrease to where you may or may not need any additional thyroid support. And you may be just fine with once in a while taking a thyroid glandular. You may not need a medication, but depending on how much damage has been done to the thyroid, you might still need thyroid medication in the long term. So there's no shame in that. There's no judgment. It doesn't mean that you didn't do a good job on your protocol. It's just if you've had Hashimoto's for a long period of time and it's gone untreated, it can actually damage your thyroid to the point where you'll need that thyroid support. Awesome. Can topical hormones help with osteoporosis? Absolutely. The primary reason for osteoporosis is estrogen loss. So topical estrogen replacement, which is the consensus overall, is that is the best way to replace estrogen, is topically. Oral estrogen is highly advised against by most well-educated hormone educated doctors. So hormone literate doctors who understand hormone replacement and menopause, the majority of them will not recommend oral estrogen because of the problems that it causes and the fact that we have bioidentical topical estrogen, which has no side effects. So why not use that when it works just as good. You can actually use a lower dose topically than you have to use orally because you don't lose a whole bunch through the digestive process and through the liver. And so topical estrogen replacement works wonders for osteoporosis. It will help you build your bones back. Absolutely. Of course, combining that with a healthy diet with enough protein and minerals and strength training and resistance training in some way, shape, or form, that is going to be a perfect storm for rebuilding your bones and living a healthy, active life. Absolutely. Let's see, can estriol pearls cause bleeding like a period when used consecutively for 9 days? In person who is 90 years old? I don't have an answer for that because I don't use estriol pearls in my practice. I would imagine they should not cause bleeding. And then if you are experiencing bleeding and you're 70, you should probably it wouldn't be a bad idea to get checked out by a gynecologist just to make sure there's nothing else wrong. Any abnormal bleeding when you're 2 to 3 years postmenopausal, you really should check it out. When you first start hormone replacement, systemic hormone replacement, there can be some breakthrough bleeding in about 10% of women. But if you're working with a practitioner, they should be able to guide you through that and advise you when like the bleeding is warranting getting a gynecological exam. If you're self-treating, I would probably say go get checked out. And if you are using hormones against the recommended use, I would say go back to the recommended use. Let's see. I'm 26. I have a 26-year-old daughter who's experienced heavier periods, clotting, severe mood changes, lots of cysts, polyps, fibroids. I was the same when I was diagnosed with endometriosis and had a hysterectomy. Her doctor wants her to get an IUD with hormones, but people she knows that had them said they made them feel worse or suicidal. She's scared to get it done now. The copper IUD can be super helpful and has like almost no side effects for girls in that situation. I would say get a second opinion. Ask about the copper IUD if that's possible. I don't like the other hormonal IUDs because they use synthetic hormones. Copper IUD, it doesn't use hormones and it can help with bleeding. But I would also look into, I don't know if she has an endometriosis or a adenomyosis diagnosis. So I would definitely look into maybe consulting with a surgeon to see if maybe she needs an ablation or she needs an incision done. An incision is when they cut out the overgrowth tissue, like the endometrial that's overgrown. So endometriosis is basically where you have cells that are similar to the endometrial lining growing elsewhere outside of the uterus. And so it can be growing in the fallopian tubes or other places in the body. And they used to do ablations where they actually burn it and make those tissues not grow, but then it can actually come back. So now they do incision surgery. And there's very specific doctors who this is what they do every day. And this is their expertise. I am not that doctor, but you can find doctors in your area this is their specialty, and they will be able to do a consultation and really help you to figure out what the best route of treatment would be. And so that's the route I would go if it was me and my daughter. See, I noticed breast tenderness this last year. Is that a symptom of low estrogen? Yes, it is. I'm almost 39 years old and my last child. Yeah, that is a symptom of low estrogen. Sometimes one of the first symptoms that women notice in perimenopause. And I would just maybe consider getting your hormones checked to see where you're at. I know 39 sounds so young. Average age of menopause is 50, 51, but that's average. So a lot of women go into menopause early 40s. And so while it seems so young, it's really just pretty normal to go into menopause early 40s as well. So I'm definitely not out of the norm. Awesome. Oh, thank you. It says your skin is absolutely beautiful. How do you keep it clear and glowing? I don't do a lot. I don't do a lot with my skin at all. I have in the past 6 months gotten some microneedling treatments done with a local esthetician. She's really good. It's where they do these. It's a treatment that you go in office to an esthetician or a med spa, and they put a little bit of numbing cream on your face, and they use this it looks like a pen, but it has all these little tiny little needles in it, and it pricks little holes in your skin, and it feels a little like someone snapping a rubber band on your face. So it doesn't hurt, but it also isn't like pleasant. but it's over pretty fast and your face gets a little bit red. It doesn't bleed or anything. There might be some little pinpricks of places that she's gone over quite a bit, but what happens is it actually forces your skin to make more collagen. And so that is actually, I think that's helped my skin quite a bit. I'm not wearing any makeup. I do have my eyebrows because I had Hashimoto's. I don't have very much eyebrows. So I do my eyebrows. I have a little mascara on, but that's what I've been doing. But also our like topical estrogen from our Healthy Hormone Club. I put just a little tiny drop of it into my moisturizer that I use at night. So I don't have a specific brand. I use, what is the brand? I use one that is peaches, something peaches. If I remember, I'll put it in the comments below the video, but it's just something simple, nothing that's fancy or expensive. But I put a little drop of the estrogen into my moisturizer 2 to 3 times a week because estrogen really does help with skin elasticity, with collagen, with moisture. And so I just use that because it's one of the like dirty little secrets of the skincare industry. Those like really expensive department store brands, a lot of times will use undisclosed estrogen in their creams. And I noticed a few companies that have been advertising to me on Facebook lately are now selling very expensive estriol or estradiol laced moisturizers, but you can just make your own. If you're in the Healthy Hormone Club and you're using topical systemic hormones, you can just put a little in your moisturizer. Little caveat, if you're doing salivary testing for your hormones, stop using it in your moisturizer a week before, just because if you put it by your mouth, you might get a false high reading on your hormones. So that's just a tip, but thank you. I had a total hysterectomy 20 years ago with no hormone replacement because of what they thought at the time. I am so sorry. That is quite a disservice to you. I want to start them now. Reverse damage that has occurred due to my decreased hormones. Absolutely. I can't promise full reversal of everything, but you definitely have a lot to gain from replacing your hormones now, especially for heart health, for brain health, for bone health, for just regular mood, memory, body composition, muscle, all the things, libido, just enjoyment of life for sure. Do you replace testosterone with estrogen and progesterone for women? We do optimize testosterone levels. We do that in a couple of different ways. One of them is topical DHEA. So topical DHEA is a hormone that men and women both make. It is a precursor to testosterone. And when we place topically in women, it converts about 50% to testosterone, but does not have a lot of the negative effects of testosterone replacement in women, which include facial hair, acne, hair loss, belly fat, and kind of aggressive, irritating moods. So that is one of the best ways that we found in women to optimize testosterone levels. Some women don't need any help with their testosterone, however. We always test levels and we're looking to get into the high optimal range. Mid to high for most women is where they feel the best. Some women do like to be right in the middle, but I notice if they're below midline on their testosterone, they usually do feel a little bit low energy and not their best. My husband is very sensitive to estrogen. What is the best way to do HRT without putting it on him? If you're using a good hormone replacement, if you're using topical estrogen, it will absorb in about 10 to 15 minutes, like fully absorb and not be able to expose him. But you can also put it on like areas that you're not touching him with right away. So like behind your knee, inner thigh, lower abdomen, and then within 10 to 15 minutes, it's fully absorbed into you and you can't get it on him anymore. So nothing to worry about. If you're using low dose vaginal estrogen, go below, it's going to absorb as well in 10 to 15 minutes. And the dose is so low that it's the same amount that he would have in his skin anyways. Let's see, if you have significant osteoporosis, can hormone replacement therapy be a useful adjunct therapy to help build bone, even at this age? If you already have osteoporosis, absolutely. Just like the cells in your skin, just like the cells in the rest of your body, your bone is, well, we think of our bone a lot of times as like this thing that's not living. Your bone is constantly breaking down and building up, and you can absolutely rebuild bone at any age. So as long as you can still be on this live and type on your computer, you can still build bone. So absolutely. The study you mentioned, testing topical bioidentical hormones that you would prescribe. Is the study you mentioned using, yes, exactly. I can't find a study when asked my doctor about, oh, are you talking about the theta cyanide study? I can put a link with the replay to this. Let's see, when I asked my doctor about HRT, she responded, I could try HRT if I don't stroke in first weeks, I should be good. Your doctor, you need to get a new doctor. So if your doctor thinks that hormone replacement therapy causes strokes, then you need to find a doctor who understands hormones. The problem is the majority of doctors, only 1/5 of doctors understand anything about hormones. Hormone replacement, menopause education is not done in medical school. Doctors have to go after medical school to get additional training that they have to pay for on their own to learn about hormone replacement, to learn about menopause optimization, not taught in school. Of all the medical research out there, less than 1% of the dollars spent on medical research are spent on women's health, and even a lower amount than 1% is spent on menopause. Obstetricians, gynecologists, they don't learn about menopause either. They learn about reproduction, they learn about delivering babies, they learn about pre and postnatal care, but they do not learn about menopause. And nobody's learning about menopause hormone replacement. And it's a very small subset of doctors that understand that. But what I hate is that the doctors that don't understand it, they just like randomly say shit like this. Excuse my language. They just say, oh yeah, you want to do hormones, well, that causes stroke. Only oral progesterone that causes stroke, and oral estrogen can as well. But topical bioidentical hormones do not, there's no increase of stroke, no increase of clotting at all. And that is across the board well known. So I would definitely get another doctor for sure. And I wouldn't trust a doctor like that for anything if they're just going to randomly say stuff that they have no education on. So yeah, you can like easily, like right now, even before I repost this video, you can just Google topical hormones and stroke. Do topical hormones create clotting factors, or do topical hormones increase stroke? And you'll find the answer really easily. But I can put some information up as well. Let's see, I'm 62 on topical bioidentical HRT. I have hypothyroidism. I have taken prescription thyroid for years. I have notes on my RX that says hair loss may occur in the first few months of treatment. This effect is usually temporary. I stopped taking this medication 2 months ago to see if hair shedding decreased, which it largely did not. Do you know if desiccated thyroid or nature thyroid causes less shedding? So hair loss is usually a sign of low thyroid. So I haven't really seen where thyroid replacement would cause hair loss. But yeah, desiccated thyroid should not, and nature's thyroid should not cause hair loss. They should actually help with hair loss. But for treating hair loss, I actually have a whole YouTube video on that, which I'll link below this video. But red light therapy is actually very effective in hair regeneration. It's one of the most researched. So red light therapy, great way to regrow your hair. Also PRP as well. So platelet-rich plasma therapy, where they do that microneedling that I said I do on my face. They actually do it on your hairline and on your scalp. And they infuse platelet-rich plasma, which they draw blood from you and they spin it in a centrifuge and they put it back. And that really helps with hair regrowth as well. But you might want to look into your hormone levels and make sure those are adequate, because that sometimes can really affect your hair growth as well. See, I currently use bioidentical hormones. They fix hot flashes, but I'm experiencing bleeding and cramps. I have fibroids. Should I ignore these symptoms? What can be causing these symptoms? I would check with your hormone specialist and see if perhaps maybe adjusting your dose a little bit or doing castor oil packs could be helpful for you. So if you're experiencing a lot of bleeding and cramps that you didn't have before, then I would say you probably need a dose adjustment if the bleeding is lasting more than just a few days. Thanks for your response. My mom is 75 years old and we have Alzheimer's. Yeah, especially with Alzheimer's in your family, I would suggest testing hormone levels and even starting on low dose hormones just to help with the brain boosting impact of estrogen. So estrogen helps your brain utilize glucose for energy. And they've actually shown scans of like women who have depleted estrogen levels after menopause. There's actually more amyloid plaques that form in the brain. And then when estrogen is replaced, those amyloid plaques start to go away. And so new brain cells actually can be formed. And that's really cool. Is breast pain and tenderness with cysts part of perimenopause? It can be. Cysts can happen for many different things. Sometimes cysts are just normal. Most women have some level of fibroids or cysts in their breasts. A lot of times they're nothing, like they're non-cancerous, they're not causing any problems, but it can be part of perimenopause, yes. Let's see, I've been changing my nutrition over the last 3 years, and that helps so much. Awesome. Is topical estrogen by prescription? Yes, topical vaginal estrogen is typically by prescription, but we're able to actually provide it because low dose through our non-prescription over-the-counter Glow Below. So that is something that we're able to do. Does progesterone help with fibroids? It can, especially if your fibroids are due to the imbalance of estrogen to progesterone. So that's one of the reasons for fibroids is unbalanced estrogen and progesterone. So progesterone can help to balance that out and help reduce fibroids. Can you safely try Glow Estrogen Cream if you haven't had your hormones tested? Yes, because topical low-dose vaginal estrogen will not raise blood levels of estrogen. It's just going to stay local to the vaginal tissues. So the clitoris, the vagina, the vulva, and the urethra, which is the canal leading to your bladder, those tissues are going to get the estrogen and it's not going to go systemic through the body. They've done a study showing low-dose vaginal estrogen. They'll test blood before and after. No change happens. And so it's completely safe. You do not need to get a hormone test. You do not need to take progesterone to balance it out. And it's safe for even people who have breast cancer or past history of breast cancer, or who also it's safe for a lot of women who are told that they can't use systemic hormone replacement therapy. Topical vaginal low dose is completely safe. See, can hormones in the makeup or moisturizer cause facial hair, which I have a tendency for? Only if you're putting testosterone on your face can it cause facial hair. So not estrogen. No. How to help serious brain fog. I have Hashimoto's, my lack of energy and brain fog is so severe. I'll probably do a whole separate video on that because I'm running out of time. And that is actually a really good topic. Brain fog is something that a lot of people face, especially women in perimenopause and menopause. And there's a lot of things that can be done besides hormone replacement. So there's a whole lot of wonderful things that you can do to improve brain fog nutritionally, lifestyle-wise, meditation and mindfulness. Oh my God, so much stuff. I'm going to do a whole video on that. So I'm writing that down. Brain fog video. Let's see. Unfortunately, health insurances do not cover integrated medical treatments, but I have to ask, is there a BHR treatment covered by any insurance? Our treatments are not, because we are looking to optimize hormone levels regardless of what your symptoms are. There are some hormone replacement that does get covered under insurance, but they're only covering for specific symptoms like severe hot flashes or severe vaginal dryness, and they'll only cover certain hormones and certain dosages. We do not operate in that small-minded, narrow field. We are looking to optimize and prevent problems from happening. And so therefore our program is not covered through insurance, but you can use your health savings account and flexible spending accounts to purchase any of our products and any of our services, including the Healthy Hormone Club. Hopefully that at least gives you tax-free dollars. We do have some women, however, have asked for reimbursement through their insurance and they were able to get it, but I can't guarantee that at all. Do hormones apply to Alzheimer's in men as well? Men have different, so for men, testosterone decreases, shrinks their hypothalamus in their brain and causes problems with Alzheimer's, and for women, it's estrogen. So it's a little bit different. Our physiology is a little bit different. Our dominant hormones are a little bit different. Yeah, it's a little bit different. And men also have a very gradual, like their hormones go like this, gradually decline, real slow and gradual. Women's hormones, we're going along, and then we start going down, and we go down like that. That's why women have a lot more problems when it comes to hormone decline than men, because we fall off a cliff at menopause, and they just gradually, it's like nice and even, steady. If there's no major overnight change, but for women, it's just like right off the cliff. And so that's why we have we need this more than men do. But some men do have low testosterone levels and low thyroid, and they should get treatment as well. Do you offer natural T3 plus T4 for hypothyroidism? Does a natural combo exist? So we offer some thyroid glandulars, but we're going to refer you out for prescription thyroid. It's not something that we can do in this format, but our program is more sex hormone replacement, but we have some great places we can refer you out for thyroid hormones as well. Will HRT help with atrophy that includes inner lips shrinking and the kind of melding sticking to the outer? Yeah, exactly. So you guys, I have women who come to me and they're like, I do not know what happened down there. One day my vagina looks totally different. Like everything's changed. I just never noticed that things were hanging down and things are shorter and things are like not looking right. It looks like my vagina turned inside out. All these different things, you guys, there's nothing that I haven't heard or seen. And yes, hormone replacement can help, but it is a gradual process. And there's some situations where it may have gone longer, where there's a lot of change that happened in the actual appearance. And there you may need to get some additional treatments that are available to help to reshape and remodel and remold the area, which are not things that I personally do, but you can definitely, there are med spas and clinics that focus on vaginal rejuvenation surgeries. And that is an option as well. But it can definitely help things from getting worse and also help improve once things get plumped up, like they reverse the atrophy, restore the moisture, restore the plumpness of the skin. You'd be surprised how things change, how they look and how they appear and how they feel. Absolutely. All right, you guys, I'm going to wrap this up. Thank you so much for being here. If you won one of the prizes, please email support@glownaturalwellness.com. That's support@glownaturalwellness.com. Let us know you're a winner on the Q&A today, and just tell us what you want. You can pick between Daily Glow, Glow PM, or Glow Below. And you can go to our website, glownaturalwellness.com, go to the shop, and you can click on and learn about each of those if you want to read more about them before you pick what you want. And if you're watching on the replay, don't forget to put kittens and dogs below this. Be creative, use emojis, say hi to Paxton, and he will pick a couple more winners over the weekend or over the next 2 days from when I post this. So go ahead and post below. If you have other questions, please post them below the video as well. And I do read all of the comments and I do answer all the questions. And sometimes I'll make a whole video for to answer, because if it's something that a lot of people are asking about, then it's something that warrants a whole video. So thanks so much. We'll be back here again in 2 weeks. I try to do these Q&As every other week. So if there's a topic that you're interested in me covering in more detail, please go ahead and email that to support@glownaturalwellness as well. And I'm more than happy to start off the Q&A with a specific topic that is of interest to you guys. Thank you so much. Hope you enjoyed our time together. I always love hanging out with you guys, and I will talk to you soon. Take care. Bye-bye.